How to increase your chances of having twins? That's a nice question. I would like to know, how can I increase my chances of having twins? That will look at from two angles. One will look at natural way of doing it, and the other one will look at it during an IVF cycle or any assisted reproductive technique. How can we increase your chances of having twins? There are naturally some circumstances, whether naturally or through medical, that may increase your odds of having twins. Then how to get twins naturally? If I'm going the natural way, the question is, how can I get twins? It is estimated that 1 in 250 pregnancies result in twin pregnancy. There are only two ways to conceive twins, or probably there are only two types of twins. It's what we call identical twins, which is a single egg fertilized by a single sperm and resulting in a baby. And that is we called identical twins. Right? The second type of twins we call fraternal twins, which is the most common type of twins. And the most natural twins, or with no any other medication, are called what we call a fraternal twins, non-identical twins. In this scenario, it's 2 eggs plus 2 sperms fertilized, and then implantation happen of these 2 people. This is like 2 occurrences. It can be a male and female happening at the same time and go to implant at the same time. And these people don't share any DNA chromosome. Therefore, they are not a blueprint of each other. Factors that may increase your odds of having twins naturally. Genetically. Remember, if genetically you are a fraternal twin, being a male or female, you have much more chances of actually producing another twins due to a genetic inheritance of what you call hyperovulation. These people, especially female, produces more than 1 egg as a genetic inbuilt of them. Therefore, these 2 eggs which are fertilized lead to what is called fraternal twins or non-identical twins. Hyperovulation can be passed down in your DNA as either from mom or dad. The other common or chances or anything, a factor which may increase your chances of having twins naturally is age. Yes, age can do that. Although the problem of age is that it's also above 35. And above 35, you're also advanced maternal age, with all risk associated with advanced maternal age, and twins can add on that. Therefore, you can look at it that way, but at the same time, you can be 35 and healthy and go through with no problem through pregnancy. But usually advanced maternal age had complications like preeclampsia and gestational hypertension. Height. Some studies confirm that people of a certain height have got higher chances of getting twin pregnancy as well. That's been confirmed through analysis of some data as well. And weight as well has been associated, especially BMI above 25, with increased chances of twin pregnancy. Although I wouldn't encourage you to gain weight so that you can have twin pregnancy. But the study in Norway in 2016 actually confirmed what I'm telling you. Then race as well is being implemented, which is true. African women have got a higher chance of twin pregnancy compared to white counterpart. Lastly, diet. A certain diet, especially yam, which has been eaten a lot in countries like Nigeria. Nigeria have the highest number of twin pregnancy in the whole world. That is been because of the nutrients or their food, which is called yam, which got high phytoestrogen that mimic like estrogen, which makes them to hyper-ovulate, and in other words, produce more than one egg, and that increase the number of twin in that country. There are also association of twin pregnancy with previous pregnancy, especially if you've got high multiple pregnancy, a lot of babies. Therefore, you stand a chance of having high, your odds of having twin pregnancy very high, and especially with age as well, combined with multiple pregnancy, age above 35. Now, let's go to IVF or any form of ART, treatment for infertility. Can any form of treatment for infertility increase my chances of having twin pregnancy? Yes, that's true. We can take IUI. IUI as a procedure itself doesn't increase your chances of twin pregnancy. However, the medication which is used for in IUI may increase your odds of having twin pregnancy. In a 2014 study, this is very clear in that Clomid increases your odds of having twin pregnancy by 7.4%. Femara, though, didn't do much. It's actually the increase was 3.4%. But with the gonadotropin, FSH and LH increase your chances of having twin pregnancy by 30%. Therefore, definitely medication which is used for in IUI do increase your chances of having twin pregnancy. When you look at IVF cycles also, we pick up the drugs in IVF are associated with increased twin pregnancy. But now, when you come to the second factor as well in IVF, whereby the number of the embryos which you transfer back also have proven long before PGT-A testing, which now give us a chance to only put back only one embryo. But before, because we're not using PGT in most of our cycle, then the number of embryo we shall transfer 2, 3, so that on itself increase your chances of twin pregnancy. Now, looking at the percent-wise, the rate of twin pregnancy in IVF with fresh embryo transfer is about 12.1% in women below 35. Therefore, the rate of IVF itself, with embryo transfer in a person below 35 have 12.1% chance of twin pregnancy. However, this pattern doesn't increase with age. In other words, if you do more IVF cycle in older patients, there tend to be a decrease in the number of even pregnancies and even twin pregnancies with age. Therefore, twin pregnancies in IVF cycle decreases with age. Then the other question may be how to increase your odds of twin pregnancy. Yes, it's very good to plan and have more twin pregnancy, but as a last word on this topic, I would say a single pregnancy have a higher chance of success, and a single pregnancy can increase your chances of pregnancy as well, or taking that patient to term. We shouldn't forget that twin pregnancies are associated, especially with preeclampsia and gestational diabetes. Therefore, it's very important that, as a doctor and patient, we discuss the issue of twin pregnancy and we understand it clearly. And we understand that there are problems which may be associated with twin pregnancy. Single twin pregnancy doesn't mean doesn't have complication or problem associated with it, but a thorough screening before you start your IVF cycle And a communication between you and your doctor is very important so that you can be guided through with this process. Thank you.